Welcome to Your4State.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you again, Dr. Michaels.
Thank you, Angie.
Now, our question for you today is, what are fungal toenails?
Well, fungal toenails basically are a thickening of the toenails. It's a condition where fungus invades the toenail, begins to grow, and causes the toenail to get very thick and yellow and brittle, and it can be somewhat painful. If left untreated, it can spread to other toenails and even fingernails. And as they get thicker, they can cause the toenails can cause pressure on the toes and create an ulcer, which leads to an infection and possible amputation if in the most severe cases.
All right, so tell us how we treat this.
Well, it's treated four main ways. Now, these ways are based on evidence that actually works. There's a lot of anecdotal treatments for toenail fungus. The first way to treat toenail fungus would be a pill. There is a pill called Lamisil, and there are other medications like this, but this is the most common type used today. With this, you take it once a day for 3 months. Stays in your system for up to a year, and it continues to work even after you stop taking it. However, the side effects could be liver damage or liver failure. So we have to do blood tests to make sure the liver is okay when you take this medication. That's the downside to it. The next way to treat it is topically. Now, there's a lot of topical treatments out there. Most don't work, but we found one that does. We use this at our institute quite a lot for this condition, and it's called Toenail. It comes with a shoe spray to kill the fungus inside your shoe. It also comes with a cream that you put on your toenails, and you put it on twice a day, and we've found that this works better than anything, and there's no side effects. The next way to treat it is surgical removal of the toenail, so you don't have a toenail anymore. Now, this is a good option for people who are older, who have arthritis, and can't reach their toenails. It's not an option for everybody, but it does work very well, and when you don't have a toenail, you can barely even tell because there's a hard keratin or a hard material that forms in place of the toenail, so it doesn't look that bad. And then finally, doing nothing, it spreads, gets worse, and leads to the complications before. So those are really the four main ways to treat it. I prefer to go topically at first. If that doesn't work, you can go ahead and take an oral antifungal medication. We do the blood test to make sure you're safe, and that usually takes care of the problem.
All right, thanks so much. Once again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle